you suspect somebody has leaky gut. You're going to do the labs that we're going to describe how to do. The labs are going to give you information. And then from that information, that rules in or rules out certain things, which is good. It might rule out candida. It might rule in candida. It might rule out immune deficiency. It might rule in immune deficiency. And based on the labs, and then based on your own clinical skill and experience, you then proceed. But basically, like I said before, and we'll go back to it again later, in managing leaky gut, at some point you're going to find out if they have food allergies or not. You're going to take those out. You're going to find out if they have a bad bacteria or a bad candida. You're going to take that out. What we have in terms of TCM is about 9 different differentiations that might have to be addressed. And these are somewhat sequential. I mean, we start with the earlier ones and move down to the later ones. It doesn't mean they're going to have all 9 of these, but they might have them. But basically, in leaky gut, there may or may not be intestinal inflammation. The only way we know really is from the lab test that will indicate that there's intestinal inflammation. If it is, then we address that with formulas that are in number 1, intestinal damp heat. But if there's no inflammation on the lab test, we skip this part. We don't have to worry about it at all. Now, if you don't do a lab test and they have eczema, for example, you can assume that they have this state, that they have intestinal damp heat. Whatever's on the skin is what's showing inside the small intestine. So if they have eczema, they have inflammation in their small intestine, and you can address it. Now, ironically, you can use skin formulas for intestinal damp heat. You can use formulas that are used for skin on the small intestine inflammation, the same as on the skin. And in this series, I'm not going to give every possible formula that's out there. There's a million of them. In my book, for example, there must be 30 products for skin inflammation. So you can pick and choose. I will go through a couple things, but you don't go for the stage of intestinal damp heat unless you have knowledge that that exists. One knowledge would be the lab test. One knowledge would be that they have eczema. Okay. The other thing is when, especially children, but it could be adults, when their small intestine has heat and inflammation, their cheeks will get red. And it's always, because the stomach channel goes right there. So whenever you see this red, rosy cheek, there's probably inflammation in the small intestines. And it's usually food triggered. Yeah?
Any significant one tongue diagnosis?
Tongue may or may not show inflammation in the small intestine. Sometimes you'll see a red stripe along the sides of the midline of the tongue, which shows stomach heat. But if the heat's in the small intestine, you may not see it in the tongue. You know. I'd like to say something about tongue diagnosis. It's helpful 15% of the time.
1-5, right?
1-5. That means 85% of the time the tongue will not add information that aids your diagnosis. Not because you're not good at reading tongues, but because the tongue is not showing it. When the tongue, so don't count on the tongue to confirm a diagnosis. If the tongue shows something, it's true. Everything the books say is true. Everything the books say is true if it shows. So the coloring on the sides, in the middle, the coloring of the coats, the shapes, all that is true if it shows. So you can confirm diagnosis. If you see red on the side, you can say, oh, there's heat in the liver gallbladder. If there's red in the tit, you can say there's heat in the upper burner. But if the tongue doesn't confirm it, don't dismiss the diagnosis. Because tongue is only useful 15% of the time.
And that's just for leaky gut or for
anything? Everything in Chinese medicine. The tongue is helpful about 15% of the time. I learned that in China. I worked in China for a year. And tongue helped very seldomly. No, even in China, a lot of herbal medicine was done based on the complaints and the history, as much as anything else. When they first come in, if the inflammation is acute, you always start with that. The first place to start is to pull down the heat and inflammation is in the intestines, if you know they have it. Now, if it's not there, then the place we usually start with is liver stagnation. Now, the reason for that, and this applies throughout herbal medicine, throughout chronic cases that come in. Chronic cases usually present with a combination of excess and deficiency. The treatment strategy has got to be treat the excess first, not the deficiency. Excess means stagnation of qi or blood. And deficiency is usually deficiency of qi or blood. If you tonify first and there exists stagnation, you'll only make the stagnation worse. If they have qi stagnation, let's say the stomach spleen, and you tonify spleen qi, you'll just make that stagnation worse. You'll increase the abdominal distension and so on. If there's blood stagnation and you tonify the blood first, you'll only aggravate the blood stagnation. So the strategy is always to move the excess first. Now, sometimes you can move and tonify at the same time. But you have got to move as the first step. Let's say a patient comes in. A very typical chronic case will have many, many complaints. They all complain of fatigue. So the very knee-jerk reaction is fatigue. They need a tonic. Well, that's a knee-jerk reaction. If that's your reaction, then you're not doing it smart. Most fatigue is actually stagnation of qi and blood in the liver. It's not moving. The fatigue that's due to deficiency is usually in old people, postpartum, very, very weak people. But most real fatigue is stagnation problem. So what happens in leaky gut, in real leaky gut, is that a lot of toxins get dumped in the liver. And now the liver has to detoxify and cannot, and so it creates a situation of stagnation. And they may have many complaints. They may not be thinking leaky gut at all. But a typical patient may come in and say, I don't sleep well, my sleep is poor. Woman says, I have menstrual irregularities or menstrual cramps. I have skin problems. I have depression. I have headaches. I have abdominal bloating. I have constipation. It's not one of those things. It's all those things. This is very typical in the United States, that people come forward with a lot of layered complaints. And what I'm saying to you is that those people, the first thing you do is move the qi in the blood of the liver. If you do that only, in 1 month, half their complaints will be gone. And then you can start focusing on the real problem. Okay, what's the real problem? Is it headaches? Is it insomnia? You know, when they come back, you put them on for 1 month, you put them on 1 month's worth of medicines to move the qi in the blood of the liver. And you may or may not do acupuncture. About half my patients, I do acupuncture every week, and about half my, and herbs once a month, and half my patients only herbs once a month. Meaning they come in once a month or they come in once a week.